The Human Canary, Video 19, Poorly Qualified Doctors in the UK. How many poorly qualified doctors are there in the UK? The University of Warwick issued a report in 2009 called Non-UK Qualified Doctors and Good Medical Practice: The Experience of Working Within a Different Professional, which indicated 37% had qualified in a country other than the UK, 6% in an Economic European Area or EEA country. This figure rises to 56% for non-consultant, non-training grades: staff grade, associate specialist, hospital practitioner and clinical assistant. The report identified several areas of major concern for non-UK, non-EEA countries: language skills, ethics awareness, and compliance with the standards of good practice set out in the core General Medical Council or GMC guidance, Good Medical Practice, GMP. The University of Warwick report identified the areas where the GMC has received full medical registrations from a country other than the UK. Doctors from EEA countries total 10,803. This figure is completely dwarfed by doctors from non-EEA countries. Leading the way was India, 27,931, followed by South Africa, 7,992, Pakistan, 7,966, Nigeria, 2,912, and Egypt, 2,694. Why is there a need for foreign doctors to work in the UK? According to a report by The Guardian, Jamie Doward, Sunday, 23rd of August 2015, which quotes figures from the General Medical Council, which show an average of 2,852 certificates enabling doctors to work abroad were issued annually between 2008 and 2014, a total of 19,522. Many of those seeking to work abroad were newly qualified as doctors. There is a link below for this article. How trusted are non-EEA international medical graduates? Since February 2008, they have been effectively barred from applying for specialist training programs, and probably for good reasons. A 2013 study by Professor Sir Liam Donaldson, the former Chief Medical Officer, looked at how doctors were often referred to the National Clinic Assessment Service, the NCAS, in the UK, and whether there were any common features of the doctors who were referred. Doctors are only referred to the NCAS if there are concerns about their performance. The report found doctors who gained their first medical qualification outside the UK were more than twice as likely to be referred compared to UK qualified doctors. In September 2010, The Independent published an article which indicated the London Deanery, which oversees the training of qualified doctors, was threatening to withdraw all trainee anaesthetists from Queen Elizabeth Hospital, QEH, because of major patient safety concerns. The London Deanery report, following complaints from trainees, found overseas locum doctors unfamiliar with NHS anaesthetic equipment and procedures being employed without any induction or vetting. There appeared to be no individual vetting for locums. Some were clearly out of their depths clinically and were completely unsuited to the demands of the post they were covering, the report said. Well, nearly 6 years on, have these matters been addressed? It appears not, as towards the end of 2015, Neil Dixon, the Chief Executive of the General Medical Council, GMC, complained that the EU rules governing the checks that UK authorities can make on doctors still have major weaknesses 7 years after a patient safety scandal received catastrophic flaws in the system. Speaking for the GMC, he said it must have the same powers to check the competence and medical skills of doctors from Europe as it already does for medics from the rest of the world. In 2015, the Organisation for Economic Cooperation and Development, the OECD, issued a report which indicated Britain has one of the worst healthcare systems in the developed world. The OECD Deputy Director of Employment, Labour and Social Affairs, Mark Pearson, said that medical staff in the UK are too rushed to improve levels of care that have in many areas fallen below countries such as Turkey, Portugal and Poland. He went on to say that the quality of care in the UK is poor to mediocre, and the NHS struggles to get even the basics right, and that junior doctors are being relied upon to provide health care. So the question remains, in the UK, how competent are graduates in medicine from a non-economic European area? You can reach your own conclusion by clicking on the link below to the Medical Practitioners Tribunal Service, which determines whether a doctor's fitness to practice is impaired. Please hit the subscribe button if you want to learn more about the myths and corruption surrounding medicine. It's the little image of a Neanderthal on the bottom right of your screen. Also, please indicate whether you like or dislike this video. Thank you.